our next session is about what does meaningful use mean for consumers. So when you're talking to I call myself sometimes the dummy, the dummy, what does it mean for us? And so I want to introduce Abbe Don, who's the VP of User Experience at Epocrates, which is an athenahealth company. Her motto, make the complex simple through good design. I'd like to welcome her.
Hi, thank you. So let's do that little mic thing. I know some people were having trouble hearing in the back. Better? We good? What? Okay, anything, any other stage directions? Enter left, anybody? Okay, good. All right, thank you. So I'm here today with my professional hat on as the Vice President of User Experience at Epocrates, an athenahealth company. And I'm going to try to make the connection between something that meaningful use, when I think of it, frankly, I think, well, that's kind of for policy wonks, with all due respect to my friends in the government, and health IT geeks. So how does that mean? No, come on. Anyway, what does that mean, though, for consumers? And one of the ways I'm going to help us get there is by telling you, starting first with a story about how I got involved in healthcare. If you read my bio, you may know that I actually started as a user experience designer at Apple back in 1988. So that was, in a way, that era was kind of what meaningful use is for what health IT is now, right? Did that analogy work? I hope so. So what are we looking here on the screen? We're looking at a piece of dynamic data circa 2001 from my partner, Eve Harris. Some of you may know her as a blogger, a healthy piece of my mind, so I'm not violating HIPAA. She's quite out as a breast cancer survivor. And this was the tool that we were provided to make a treatment decision about how to address her cancer. And this is awesome, right? It's dynamic data. It was being written in real time as the physician spoke to us. It's from multiple data sources. And it's intended to help make a patient decision, a really important life decision. So, wow. So I saw this in 2001 with my user experience design professional hat on, and I said, hey, there's got to be a better way. And perhaps there's some way I can pivot in my career and bring what I've been doing in consumer media and technology, and in particular personal storytelling, into healthcare. And I didn't know how that would take, which form that would take. And without going through my whole bio, I basically went from Hewlett-Packard to IDEO, and then at IDEO I made a pivot focused on healthcare, and from there I got to know athenahealth, and now I'm working at Epocrates. And so I'm going to try and help make that connection between meaningful use and consumers, and what the meaningful use enables in terms of first making data available and then connecting it to people. Now, one of the reasons why you might want to care, if you don't already from the other panels today, is just thinking about costs, which have also been mentioned. So it turns out that as of 2012, for a family of four, healthcare costs about $20,000. Now, most people don't see all of that, because as was also mentioned, a lot of that is absorbed by employers. But if you think about $20,000, that's about the size, that's about the cost of a mid-sized sedan. So imagine that you bought a mid-sized sedan every year for your family. You would probably start thinking differently and start engaging differently with that purchase. And so the previous panel talked quite a bit about value and how to combine cost and value and perhaps bring healthcare costs down, which is really part, I think, of what meaningful use was trying to help do as part of the triple aim and some of the other healthcare reforms. So it's really a set of guidelines and principles and tools to support reform and create technology infrastructure, health information technology infrastructure. And there's multiple stages. And the first stage, the first evidence of the first stage, if you will, began in 2011, was just to support widespread EHR adoption. Like, okay, America, this technology exists. Hey, physicians, hospitals, let's start using it. And oh, by the way, let's start using it in a way that would be meaningful. And so there's a set of criteria for the electronic health record vendors to get certified. And I'm sorry if this is really basic for a lot of people, but I'll try to get through it as fast as I can. So the vendors get certified, and then physicians and hospitals purchase one of these, and then they have to attest. They have to say, hey, we used it in this meaningful way. And that's the beginning, and I would call that baby steps. And those are good baby steps and important baby steps, but that was the first kind of baby step. Now we're moving into, with 2014, things that start to get a little more exciting about health information exchange and driving patient engagement. So certainly here we are at the Consumer Electronics Show, and patient, we use, in healthcare they say patient, but patient and consumers kind of are the equivalent. And then moving forward, like 6 years later, from 2001 to 2017, now we're going to talk about measurements to improve outcomes. So it's a series of baby steps, and even as we go through meaningful use, the time it's going to take to be from the baby steps of, say, something like the Mac to what we have now, almost 30 years later, we're on a long haul. Like, this is definitely a marathon. This isn't a sprint. So we see evidence periodically of some sprints, of some great things that come out into the marketplace. But I think in terms of widespread adoption and widespread impact on consumers, and those of us that might sound like technology evangelists, it's going to take a while before it's as pervasive, say, as a smartphone. Be that as it may, what's going on along the way? So again, as you heard earlier, there's a series of incentive payments for those that adopt by a certain time period. And so you can see there in that image a lovely person using a tablet, and life is good. And for those that are slow to adopt or not willing or don't think it's worth the incentives, oh, by the way, there's also some penalties for not complying. So that's just kind of getting the caregivers involved. And so as of 2012, nearly 400,000 meaningful use registered caregivers. And so what does that mean in kind of like the scale of things? As of right now, there's about 50% of the ambulatory care doctors in the US have attested to meaningful use in about 80% of hospitals. So that's pretty good. We're well on our way. From a monetary perspective, $16.9 billion in incentives have been paid out. And in terms of patients, about 80% of Americans with access to an EHR actually use it. And so when they have access, it's usually through something called the patient portal. Can I just get a show of hands, even though I can't really see you? How many people here either go to a hospital or medical center or physician who have a patient portal and you've actually used it? Okay. More people are on the other side of the room. Okay, how many people have used it continuously, like more than the first time? Like you logged in, you remembered it. Okay, quite a bit fewer. So I'd be curious to know why. We can talk about that afterwards, but I have some hypotheses. So I know I've lost 3 of my passwords. I get care at Stanford, at UCSF Medical Center, and at a private practice. I have 3 different passwords, and I've logged in once, saw my initial test results, and oops. And I'm like, I designed this stuff. Okay, so what does this mean for consumers? I'm going to talk about four things that we might be able to do with the data. So I think the big thing is that the data is getting captured. So we've talked about that with Fitbit and wearable devices, now with electronic health records. Lots and lots of data is getting captured. But what's really important, as ePatient Dave and other members of the ePatient movement, you might have heard Dave's song, "Give Me My Damn Data." And DAM is kind of an expression and an acronym here. DAM also means data about me. Great video on YouTube. Give me my damn data, data about me. I can't really carry a tune, but you get the point, right? So our data, when it first comes out of these systems, looks a little bit disparate, right? So it's like, oh, there's all these different, if you are more numerical, you might have wanted to see zeros and ones here. I'm more visual. So we've got a bunch of data points, right? Okay, great. As my great-grandmother would say, mazel tov. We've got our data. And so that's super important. But the next step is to actually start to make sense of it, to synthesize it. And one way to do that is to make it beautiful, and to start to see the patterns and organize it. And again, we do this all the time in consumer apps, financial services apps. If anyone uses Hipmunk, right? It's really easy to see multiple flights from multiple airlines through APIs. Like, duh. So imagine that this is your airline system of the 80s that only the travel agent saw on the left, and then this is Hipmunk. We're like, whoa, so how long did that take? It's going to take a while for us to get there with healthcare. Then the next big piece is to coordinate my damn data. Because it turns out, like I mentioned, I see 3 different healthcare providers. So Stanford has one picture of my health. UCSF Medical Center has another picture of my health. And then my primary care doctor has another. And they don't come together. The only person who actually has that integrated view is me. And so the tools to create that integrated view are part, ideally, of meaningful use and interoperability. But right now, a lot of what I see is patients kind of hacking together their coordination. And I'll talk about that a little bit as well. And then ultimately, we want to be able to act on the damn data. So things were red in the previous slide, kind of like we got it, but green is about action. So this movement, if you will, about acting on our data, and this is what I think is the big impact for consumers, is both a top-down and a bottom-up movement. So Todd Park, who some of you may know, is the Chief Technology Officer of the United States. He said, why can't we just let any American get a copy of their own information? That seems reasonable. And then at the same time, you have people like Dave and some of the patients that we'll be hearing from this afternoon, the loudmouth patients that are like really doing a grassroots kind of bottom-up populist movement to unleash the data, right? And not just unleash it from the multiple silos, but start connecting it. We've also heard about Blue Button, and immediately after I speak, Lygia is going to talk about that as well from ONC. But it's a fantastic first step, and it's a great way of opening those data channels. And once we get those data channels open, it's going to be very hard to close them down. So it's terrific to get the data flowing. And one of the big differences, say, between if Blue Button is to healthcare what DOS is to personal computers, the big difference here is that Blue Button is open source. And it's also not just one data stream just from health information, electronic health record vendors, but other health data as well, which Lygia will go into in great detail, so I won't. OK, now patient portals. Many people raise their hands that they've at least tried their patient portal. Far fewer continue to use it. This is an example of a mobile patient portal. This is actually, OK, this is the like 10-second advertisement. This is Athena Communicator. So if you happen to be a patient whose physician is using Athena Clinicals, there's also a component called Athena Communicator that tries to start to present information in a more user-friendly way and lets you get access to your record and actually interact with it in a way that makes sense to you. Not only lets you see your data, but also start to make appointments or refill medications. And these are, again, baby steps, but they're good baby steps. Now, moving on to Beautify, again, no diss on Blue Button. It's a fantastic start. But initially, what comes out does, my friends, look a bit like DOS. So this is just some text. And it's important text. It sort of tells you what the data is, and then the type of data, where it came from. But if you're a patient and you're looking at this, is it very easy to act on this? Is it very easy to understand it? It's great to have it, and I'm not saying patients can't understand unstructured data. It's just not so actionable, right? There's more that we can do. And so, for example, the government sponsored a health design challenge, and this is just one of many really fabulous entries. I should have had the URL up on the screen. I think it's healthdesignchallenge.gov. OK, Twitterverse, help me out. Someone go look it up while I'm here and get the right URL. I'd really appreciate it. And then, short URL it for me. OK, tiny URL it. That's the word. All right. So anyway, but you can see the difference, right? ASCII designed experience. And then this is one that I happen to be proud of, and I confess it's not for consumers exactly, but this is a type of data that you get from labs. It's called an antibiogram, and it's about how bacteria is depicted for infectious disease docs in a hospital. And you've got all your bacteria along the left of your screen there, and then you've got rows of, columns of medicines, antibiotics that have been tested against that to tell you how effective they might be. And then this is an app we just designed at Epocrates called Bugs and Drugs that makes that data much more alive, responds to physicians wanting to know bug-drug sensitivities, and then being able to connect and act on it immediately through referencing the Epocrates drug monograph there. So it's data plus action plus patient care in the moment of care. So again, just trying to make the point about what beauty, and not just beauty being skin deep, but really turning data from something visually compelling, quickly digestible, low cognitive load. That's something we talk about in kind of traditional HCI and usability, and then taking it right to a decision. So if you just think about this paradigm, I think this is how it's going to impact consumers. The data, first and foremost, becomes available. We talk about liquidity of data, so it becomes more liquid. And then you can start doing this kind of codathons, designathons, and bring a wider set of practitioners. We need our clinicians, our entrepreneurs, and designers to get more involved. When we move from beauty to coordinate, this is what one of my designers calls a fluster cluster of care coordination. And so what you have here is what it looks like on the physician side. Like if you're inside a provider or a clinical setting, up there on the left, we have our fax machine. Now, who doesn't love a fax machine as a great way to send data in 2014? Then over on the right is an image, top right, is an image from an ambulance. A story of an ambulance going to the emergency room. And so they printed out when they got there, here's our electronic health record. We captured all this stuff on our laptop in the ambulance. OK, great. Let's put it on a gurney and now type it into the hospital system, because they don't yet talk, right? And then another type of coordinated care is a doctor's referral. Any given doctor probably interacts with hundreds of doctors a year in terms of their referral network, and thousands of patients. So one great way to do that is business cards. I just hand my business card. Perfect. We've got this nailed. So I'm being facetious, because there's probably quite a bit more we can do with coordinating care and managing these streams of data. Here's what it looks like from the consumer side. So I had the privilege of doing quite a bit of consumer research and patient research when I was at IDEO. And this was part of a project that the California Healthcare Foundation funded. So we spoke to this woman, Veronica, and she has multiple chronic conditions over many years. And so her care team up in the right comprises about 15 different caregivers. And her mental model is about the frequency with which she sees them. So their first set is kind of the core. She sees them monthly. The next set up is the people she sees about every 3 months. And then the people up at the top is that she sees as needed. Like Veronica was also based in the Bay Area, and so her care is also across these many different fabulous academic medical centers, and they all happen to be use the same vendor, but it turns out within that vendors, because it's a closed garden, they don't actually talk to each other, at least not yet. Health information exchanges suggest that they will soon be able to do that, but it's not so seamless. So here's what Veronica's doing. First, she was creating tons and tons of paperwork, and documenting things and putting every explanation of benefits and every approval and everything she signed at every single hospital in this really large notebook over there in the bottom right. And then she advanced to the iPad. But she still keeps the other stuff for a record, because she's not going to take the time to digitize her paper records, which, again, is part of electronic health record adoption. Is a lot of physicians in clinical settings, they are trying to bring those records forward. So Veronica, when she goes around to her healthcare providers, schleps this whole set of data with her. And so this is how care coordination is happening from the patient perspective. But we have things like Mint. And so Mint integrates all these different streams of financial data. People like to talk about financial services and healthcare a lot, right? But it's a great analogy, because many of us have multiple relationships with multiple banks. Savings accounts, checking accounts, mortgage, investment accounts, trading. And what Mint has done so beautifully through the wonder of APIs and also appropriate security and permissions is you get to say, yes, I want to bring, with my password, all these data streams together into one unified view of my financial life. And so that's really the ultimate impact, I think, that we'll have both for physicians and for consumers, is to be able to bring that view of your healthcare, not just in the moment, but over time. And so what might that look like? This is an example of something that we're actually doing at Athena that we call the network face sheet. And so a face sheet, if you think about the traditional manila folder that the physician had, there was a piece of paper on the front of that folder. If physicians in the room, you guys might remember this. Maybe you still use them. Anyway, that face sheet was sort of just the stuff I need to know right now to treat you, right? So that when the physician walks in, they can say, hi, Abby, it seems you were last here a month ago, and how's that infection, or whatever I came there for, right? So needless to say, this is an example of the Athena face sheet then being able to bring in, through the wonders of collaborations with organizations like Commonwealth, which is an electronic health record vendor consortium that's sharing data and trying to do for, yes, I got myself in a loop there, or in a dead end. Sorry. Are you recording this? It'll be there for posterity. Anyway, what Commonwealth's trying to do this data exchange. OK, so what this network face sheet on our roadmap for roughly 2014, hello R&D folks over at Athena, don't tweet me badly, is that this would not only have Athena data, but competitor data, claims data, and eventually we see no reason why this couldn't also have patient data or tracking data from consumer devices, as needed, especially when it really impacts care, right? So one of the challenges with all these data streams is, does my physician really need my Fitbit? If I'm a member of the Worried Well, which is great, be preventive, but I have 19 minutes. Anyway, be preventive, but include that data only when you need it. So, and then there's also this fabulous collaboration panel. In terms of acting on the data, there's a lot of great tools out there. I've just got a couple I wanted to show. Argus, I think, is doing some really, really interesting things using the new motion sensor in the iOS 7, I'm sorry, in the iPhone 5S. And so in addition to the things you can track automatically with the phone, it also invites you to track some additional things, and it gives you, again, this integrated view. They're using this kind of honeycomb motif. Ovule is a great tool for couples trying to get pregnant and having fertility issues, especially a lot of the trend generally is for women to delay getting pregnant as they pursue their careers. And so it turns out something that should seem really simple can actually be quite complex. And here's something where people are highly motivated, and there's actually, again, a lot of data from a lot of different important data points to bring together into patterns that you can represent to the people who need the data, mostly the couple. And then the other really interesting thing about this is that they are collecting data from multiple users and looking for patterns, and then using pretty big data and science on the back end to help people both in getting pregnant and in tracking their pregnancy once they do get pregnant. And then finally, tip from the future, some of you may know about MC10, this very flexible electronics that can be embedded in lots of different places. So we're taking baby steps. We're eventually going to go from the Mac, which is about to turn the first Mac, remember, was 1984, was 30 years ago. So imagine that little baby that said, hello, world, to this. We'll be there. Let's talk in 20 years. All right. Thanks.